and the most exciting and promising new future treatment for Alzheimer's disease is a drug called Alzheimer's disease. Is the most common form of dementia, estimated to affect 6.2 million people in the US alone. Dementia is an umbrella term for progressive neurodegenerative disorders, which can lead to a loss of brain function, and it can be devastating for both patients and families because it can lead to loss of memory as well as even a loss of personality. In this video, we are looking at what causes Alzheimer's disease, the current treatments used to treat Alzheimer's disease, 5 possible future treatments for Alzheimer's disease, as well as things you can do to avoid getting dementia in the first place. And we're starting right now. So what causes Alzheimer's disease? Well, the disease process is not fully understood, but what we do know is that there are often seen to have beta-amyloid plaques as well as tau proteins in patients with Alzheimer's disease. It is thought that these abnormal protein structures disrupt in the brain's usual function and can lead to cognitive decline and even death of the brain cells. These beta-amyloid plaques and tau proteins are often concentrated and seen in the hippocampus part of the brain, which is a seahorse-shaped part of the brain. Alzheimer's disease is sometimes called type 3 diabetes because of the link between insulin resistance and diabetes and neurodegenerative disorders. Current treatments for Alzheimer's disease only slow down the progression of the disease and help with symptoms, so things like memory loss and cognitive decline. They do not target the underlying cause of Alzheimer's disease process, so there is still a decline and death of neurons. The most commonly used are cholinesterase inhibitors, including Donepezil, Rivastigmine and Galantamine. These increase acetylcholine levels in our brain, and acetylcholine is a neurotransmitter that helps to communicate between brain cells, so they help to improve the function of the existing brain cells and slow down the disease progression. There's also NMDA receptor antagonists such as memantine, which help to regulate glutamate levels in our brain. Glutamate can often be too high in patients with Alzheimer's disease, and this causes calcium levels to increase in the cells, which can lead to an increased rate of degradation and death of these cells. So NMDA receptors antagonists work by preventing the docking of glutamate to cells. Deep brain stimulation has also been used for many years to treat Alzheimer's disease, especially in severe patients. This is where there is a device implanted into the brain to help improve neuronal signaling. Let's look at some of the exciting new possible future treatments for Alzheimer's disease that are currently being researched and developed. The first is saracatinib, which was initially developed as a cancer treatment, but it was found in my studies to turn off a protein which allows the synapses in our brain cells to start working again. And saracatinib is now undergoing human trials, so this is an exciting new treatment that may prove to be beneficial to Alzheimer's disease. The second are tau aggregation inhibitors and tau vaccines. These are aimed at targeting the underlying process of Alzheimer's disease. So the goal is to prevent tau proteins from building up in the brain, which can often lead to disruption of brain function and even death of brain cells. And these are currently undergoing clinical trials. Third is sargramostin, or leuking. In Alzheimer's disease, it's often seen to have low-grade chronic inflammation of the brain cells. So sargramostin hopes to target the immune system to help to stimulate the immune system to clean up some of these waste proteins and protect our brain from these harmful proteins. Number 4, there are currently studies to examine the relationship between heart disease and Alzheimer's disease. There's plenty of evidence to show that heart health is also great for brain health, and there's many diseases which cause heart disease and attack the coronary arteries, which can lead to Alzheimer's disease. So this research hopes to find new drug targets that prevent the heart disease side of things that can lead to Alzheimer's disease. And if you want to find out more about the relationship between the heart and brain, I've made a video about that, and I'll leave a link to that video in the description below. And the most exciting and promising new future treatment for Alzheimer's disease is a drug called aducanumab. Aducanumab was FDA approved back in June 2021, and this is the first drug that has been FDA approved in over 20 years in the USA. It's only available in the USA at the moment and is currently undergoing human trials. Aducanumab is an IgG1 amyloid beta monoclonal antibody which is selective for amyloid beta aggregates. So they target the underlying cause of Alzheimer's disease and stop amyloid beta plaques from building up in the first place. So it hopes to prevent the progression of Alzheimer's disease and treat the underlying cause. Aducanumab was FDA approved under the condition that it undergoes further clinical studies and trials to prove that it works. So it's still in its infancy and early stages, but it is looking very promising that this drug may be used as a future treatment for Alzheimer's disease. It's only currently available in the USA, so the rest of the world will have to wait and see what happens with this drug. So what can you do to prevent getting dementia such as Alzheimer's disease in the future? There is increasing evidence and research to suggest that Alzheimer's disease as well as other forms of dementia are actually reversible and preventable through healthy lifestyle habits. Though things like exercise habits and eating healthily are both neuroprotective. Exercise helps to release a substance called BDNF, which stands for brain-derived neurotrophic factor. And this helps to repair damaged brain cells, maintain existing brain cells, as well as strengthen existing brain cells. So these all reduce the risk of future Alzheimer's disease and dementia. Developing new drugs and medications is often a very expensive and very slow process, often requiring several stages of clinical trials before they can be approved. So these drugs are in the very early stages and may take a few years for us to really understand if they work or not and for them to be available worldwide. But it is exciting to see progress finally being made in such a debilitating disease for many people. If you found this video helpful or interesting, smash the like button right now. If you want to achieve better brain health, you're going to want to hit that subscribe button. Check out this video on the brain and heart connection and how they interact with each other and how the human heart works. I hope you guys have a wonderful rest of your day. I will see you guys in the next video.